With the holidays approaching, family get-togethers are on the horizon, which means tons of photos. But if a crooked or imperfect smile has you shying away from the camera, we might be able to help. Melissa Paul chatted with Dr. Andrea Joy Smith about her solution for getting patients that perfect smile.
Always great to have you here on the show, Doctor.
Thank you, Melissa. It's very great to be here as well.
Okay, so why should people be concerned about gum recession?
Well, when our gums recede, we can also think of it as our bone receding or going away as well. So when we lose bone, that makes the teeth become loose. And with loose teeth, it could lead to tooth loss. So that's something that you'll want to catch early before it gets to the bone loss and the tooth loss stage.
Okay, and you offer a procedure. It's actually a rejuvenation, and it's different than the gum grafting that we're very familiar with. So tell us about the rejuvenation and how is it different?
It's different because in traditional grafting, there's normally a piece of tissue removed from the roof of the mouth, and then the surgeon will create an opening to place that gum tissue under the recessed area. And after that tissue is removed, it is then placed in the area of the recessed gums, and then there's stitches that are placed to hold it into place. And as you can see, the results are not really immediate. You'll have to wait the 4 to 6 weeks for that to heal to see the effect. Well, with the pinhole surgical technique, we make little tiny insertions into the gums, and then we use specially designed instruments designed by Dr. Chow down in Alhambra, California. And what we do is we gently position those gums into the proper position. And rather than using sutures, we then place collagen strips into that area so that it holds the tissue in place, and there's no need for sutures, and then the results are pretty much immediate. You won't see the recessed gums anymore.
Wow, oh my goodness. So you're actually taking the gum that already exists in place and pulling it into position, if you will, and then holding it into position.
Absolutely. It's a lot less invasive. It doesn't involve scalpels or sutures, and that collagen holds it in place.
Okay, and so why did you, Dr. Smith, find it important to offer this type of procedure to your patients?
Well, I've been a general dentist for about 25 years, and over the years, I've had patients who have had a history of having the conventional gum grafting. And the procedure is a bit more invasive, a lot more healing time, a lot more downtime. So patients often do not want to repeat that. And with that procedure, you can only treat 1 to 3 teeth at a time, sometimes more. But with the pinhole surgical technique, you can treat the entire mouth. And now I no longer just have to watch patients with receding gums and make the referrals that they don't often attend, and they can have their gums rejuvenated in one visit in the entire mouth if necessary.
Wow, so you're cutting down on the invasiveness and the length of time, length of treatment.
Yes.
Wow, okay.
And the results are immediate. That's one of the things I like about it as well.
Okay, well, let's go ahead and take a look at some of those results. This is quite miraculous. So point out and tell us what we're seeing here.
Yeah, on the left side, you can see that the gums are raised above the crown or the white part of the tooth. And that usually happens either with tooth grinding or aggressive tooth brushing. But on the right side there, once the gums are moved to the proper position, the teeth look normal size. And of course, it looks like that patient had some teeth whitening afterwards as well.
That's a nice looking smile.
Yes. And in this case, if you look on the before picture, the gums are high above the crown of the tooth. And again, either grinding or clenching or aggressive toothbrushing has led to the gums, to the gum recession. And on the right side of the screen, you'll see that the gums have been moved to the proper position, both the top and the bottom. And again, it looks like the patient had some tooth whitening as well. It's a dramatic difference.
Okay, and doctor, when people come in to get this procedure, what is it like? Walk them through the experience.
Sure, they come into the office, they are numbed with normal lidocaine that we normally use to numb our patients for treatment. And then we use tiny needles to insert and make a pinhole. And then we use the specially designed instruments to guide those tissues into place. And in about an hour or so, the gums have been repositioned. And normally, if there's any discomfort, it doesn't last more than 24 hours. And I normally can have the patient take some ibuprofen and Tylenol over the counter without having to make a strong prescription.
Really?
Yeah, it's amazing.
Wow, that is a drastic
procedure.
difference. Yeah.
Very much so.
So if someone is interested in this procedure, what do they do?
Of course, they can call my office at 916-482-8300. They can look at us on social media, Instagram, Dr. Andrea Smith, And our website is smileagainnow.com.
I imagine a lot of people are taking a deep breath right now going, oh, finally, because I imagine a lot of people suffer from gum recession, and to hear that there's an option that's less invasive,
Yes.
because that's intimidating when you talk about gum grafting.
Yes, it is.
Now there's an option that will likely suit everyone. So that's
Absolutely.
fantastic.
Well, thank you. Thank you for
Great.
letting me come on and tell about it.
This interview involves commercial content. The products and services featured appear as paid advertising.